lots of presentations on osteoporosis, but I'm really pleased to be talking to a multi-generational group because, as I was saying, I normally am dealing with seniors, and it is a pleasure to be able to present this information to younger women because truly osteoporosis, there's been a lot of good research in the last 25 years particularly, and it's preventable and it's treatable, and the news is all good as long as we know what to look for and when to intervene. So that was a long intro, wasn't it? I wanted to talk a little bit about osteoporosis itself. It's often mixed up with osteoarthritis. So osteoporosis just means porous bone. It's a disease of bone. And osteoarthritis is really a disease of bony joints. So there's a little bit of a difference. Not to say that you can't have both, but just not to confuse the two. So osteoporosis is really common, and it is a silent type of disease. You don't really know that you have any problems at all until you have a minor fall and it results in a broken bone. And you know, we get up in the morning, the only part of our skeleton we can actually see are our teeth. So we brush our teeth and hey, they look the same every day. So you assume that nothing's happening in your skeleton. But your bones are very active. Metabolically, they're building up and breaking down and replacing themselves. So they're a very vital tissue. And for that reason, we need to be aware of what's going on with them. So I have a photograph or a diagram here of parts of the body, of the skeleton, that are most commonly prone to fragility fractures, or fractures because your bone strength is decreased. And there is a reason for that. That's not just random. It's because the wrist and the hip and the vertebrae in your spine have spongy bone or trabecular bone. And this bone is lightweight and strong normally, but if the balance of bone health is tipped so that the bone becomes fragile, then it's the most likely place to fracture. And when I say a fragility fracture, you define that as a fracture that happens, say, just standing from standing height. So if I was to fall over right now, normally you'd have a bruise and maybe a scrape or a sprain, and you pop up and you look around the room to see who saw you fall. So that would be a normal reaction. But if I was to fall from standing height right now and break my wrist, that would tell me that my bones are weak. So knowing what people were doing when they had their fracture becomes clinically extremely important. And I'm going to talk about a little bit more about the spine itself. And this just gives you a visual. So the left side shows a normal vertebrae that would be in the middle of your back. And cross section of the bone, you can see it looks a bit like sponge toffee. And on the right side, there's a bone that's a little bit shorter. And if you were to look inside of it, the sponge toffee would not be connected well. So that is what osteoporotic bone looks like. And you're probably wondering why I brought Play-Doh, but I like to use Play-Doh because it explains a lot of things about spinal bones. So if each one of these little round Play-Dohs represents a vertebrae in your back, very simplistically. When the vertebrae are all stacked up nicely, they form a nice, fairly straight column. And if you were to have a weak one that broke, so let's say, we'll take one here. Kelty, you can be my assistant. Hold those for me. Let's say I had a fall and landed right on my bottom just from standing height, and this is often what results. So the bone becomes wedge-shaped. And if you put that in perspective with all its nice straight vertebrae, this is what results. So if you have a wedge in the middle of the column, it's going to change the shape of your spine. And people often talk about the very unflattering sound, dowager's hump. And that's often associated with the posture of osteoporosis. And there is good news coming, so I don't want you guys to panic.
Good.
Yes. Those crush fractures, they really hurt. People will do something like, perhaps they were trying to open a window in the springtime, and then they get this awful pain in their back, and the pain will last for about 8 weeks, and it will go away because bone is very well supplied with blood and heals nicely, but it's a common cause of sudden acute back pain in older people particularly. And I wanted to add in the rest of the skeleton now because I zoomed in on the spine very quickly, but I wanted you to take a look at this skeleton, and if you were to look at these three people, you can see on the left-hand side, this is 55, the middle 65, and the right-hand side 75. And what we're trying to point out there are changes in the spine with time. And I'm going to use my stick for other purposes. Vandervoort's hardware. This too can be yours. So excuse me for putting it back to you ladies. I just want you to take a look at those three skeletons and just take a look at the top of the pelvic bone here, the place where we put our hands on our so-called hips. And you can see that that stays consistent all the way through. But if you were to look at the top line of the person's height, you can see that the person's becoming progressively shorter. And the diagram of the spine is showing that your spine is changing, say at the younger version here, you have a nice gradual S shape. So it's normal to have a little bit of a curve in your spine, but it becomes progressively more C-shaped with time. And so what's happening is that your trunk is selectively becoming shorter compared to your long limbs, such as your legs. And some of the other things I'd like you to take a look at briefly too is the bottom of the rib cage. So normally, when you put your hands on what we like to call hips, if you dig your thumbs in, you should feel a space between the top of your pelvis and the bottom of your rib cage. If you were to lose that space because the vertebrae were compressed and shortening, you'd find that your ribs might be actually resting right on top of your pelvis. And that's uncomfortable. The other part of it is that there's less space in your abdomen for your, I'll say guts, that's a pretty word. The contents of your abdomen have a smaller house to live in, so they often have to protrude forward because they have no choice. And this in turn can throw off your center of balance. And for any of you who have experienced pregnancy, if you remember the part where the tummy's out to here, it does throw off your balance, and it's pretty common for pregnant ladies to have a fall. And, so that just shows a bit of a progression through time of the kind of changes you'd see in body proportions. So the reason why I'm telling you this is that I think everybody here could spot someone that had changes of osteoporosis. Just knowing that there's a change in the proportion and the length of your trunk with the arms and legs that you were born with. And this is sometimes expressed in, say, if you were sitting at a table to dine, and all of a sudden you look at the person next to you and you feel like their seat is lower than yours because their head might be quite a bit lower than yours. Or they might put their elbows on the table, and where you and I would bend our elbow, food to face, and would your food would be the same length to your mouth, you might find that their elbows are reaching over their head. So So just lots of things that you can see casually in observation that might be a clue as
Is it
to what was going on.
more common in women?
It is more common in women. Thank you for bringing that up. About 1 in 3 women will experience an osteoporotic fracture in their lifetime, and 1 in 5 men. So it does happen to men too. It tends to happen at a little older age, but it also is more devastating to men. And men who break a hip are more likely to die as a result of that injury than women.
My father of 95 just broke his hip, but he's doing just fine, thank you, when he's walking.
Wonderful.
Yes.
I'm so glad to hear that.
So I was asking,
So
yes.
glad to hear that. It's really important.
Are these pictures normal aging, or is that osteoporosis?
That is osteoporosis, and I would never call osteoporosis normal.
Right.
Okay, so that brings me back to my cover photo, and I really liked the emblem that Righ had chosen for its 40th anniversary, where you had a tree, like a family tree with all the seasons, and often when you get together for a family reunion, it's not uncommon to see a photograph similar to this. And those generations are probably separated by 25 years each as an estimate. And I used to think that my grandparents were just short people. But now I realize that they were probably the same height as me, but just had lost some height in their spine by the time they had reached grandparenthood. So sometimes this expresses itself in unusual ways. One of my friends said that her grandmother one day asked, "Who moved the mirror that's on the wall in the hallway? Because I can't see my hat when I go to put it on my head." And of course, the person had lost height and perhaps not realized it. And it's just little subtle things like that that often are your cue. Okay, so I've talked enough about osteoporosis itself to give you an idea. And now I'm going to talk about what can be done about this. And as a physiotherapist, you know I'm going to talk about physical fitness and all things physical. And I also wanted to express one of my favorite quotes. So David Butler Jones, he was the head of the Public Health Agency of Canada for a decade, just recently retired. But he said, if the benefits of exercise could be contained in a pill form, it would be the single most effective therapeutic known to mankind. And I often wish I could put it in pill form, but it doesn't work that way. Fortunately, it can be had by all, and very low cost at that. So the beautiful thing about physical activity, that it's therapeutic in treating all sort of chronic health conditions, whether it's diabetes, or whether it's, say, heart conditions or respiratory conditions. Everything can benefit from the appropriate level of exercise, and osteoporosis can as well. And I will just briefly go through some of the beneficial effects. So, increasing your bone mineral density, because your bones react to the kind of forces that are put through them. Your muscle strength, mobility and functional mobility are expressions of having healthy bones and healthy muscles. It improves your balance, which can in turn reduce your risk of having falls. Weight control is important, and general feeling of well-being, so it can help your mental health as well. And this is really important because we've figured out how to make people live longer. Just simple things like having clean water supplies and having antibiotics can make you live longer, but we have not figured out how to have people live longer and stay able-bodied, which makes a big difference on a person's quality of life. So that's where physical activity becomes a major factor. So the goals of exercise: decrease the rate of bone loss, decrease your risk of falls, minimize future fractures, and I would be remiss if I didn't talk about posture. So we need to avoid developing weak bones, and we need to treat bones when we realize that we've gotten fragile. So falls are a huge topic, and where I work, I'm the falls prevention lady. And of course, there's lots of things you can do to avoid falls, and I'm going to get into the changes you can make to your lifestyle. But it's also important to have strong bones so that when you do take a topple, you have bruises and embarrassment instead of fractures. So I'd like to put in a little quick test about posture. And all you need is a wall to test this. So everybody's got a piece of wall at home. You should be able to stand up against a wall with your heels touching it, and touch the wall with your bottom, your tailbone, and in between your shoulder blades and the back of your head. And you can actually physically measure the distance from the back of a person's head to the wall. I use a clear ruler, pretty simple technology. And you can see those two subjects that we have there. The one on the left, everything is stacked up the way you would intend it to be stacked. And the person on the right has a curve in their spine that's not allowing their head to touch the wall. So the lady on the right, I would make a guess that when she lays down in her bed at night, she has to have 2 or 3 pillows because she can't align herself completely straight. And I would also make a guess that she doesn't really have much use for the headrest in the car that she drives, because her head would be a long ways away from that rest. So those are indications that your posture may have changed. And another simple thing I often ask is just ask people, what's your height? So a change in your historic height is an indicator of the work of osteoporosis as well. And I think all of us can lose up to 3/4 of an inch throughout life just because of the discs that are in between the spine. But once it gets over 3/4, then you have to ask yourself what's going on there. And the rule of thumb is that if you're under 60, the red lights go off once you've exceeded a 4 centimeter loss in height. And if you're over 60, then 6 centimeters usually indicates that you have indeed experienced some sort of wedge-shaped fracture in your spine, which is making you shorter. And sometimes people will ask me, well, how do you tell if it's somebody who's got osteoporosis or just someone with poor posture? And so there's a series of tests you can do to figure that out. And last week I had a host call, and this lady had her head right down on her chest. That was her position of comfort. And I thought, oh dear. And then I said something simple like, look outside, and she was able to pull her head right back up into position. So I made the assumption without testing that she wouldn't be able to, but I was wrong. So it's always good to take a few extra minutes to put people through tests to see if they can actually change your postures by using their own muscles. So I'm going to talk about change because that's kind of a discouraging slide and doesn't need to be. So how can you make changes to change your posture and maybe the progression of osteoporosis? So physical fitness, and I'm going to talk a lot more about that. Canada has physical activity guidelines, and we're all to try to get 150 minutes of moderate to vigorous cardiorespiratory exercise every week. We're to do resistance training or strength training with either weights or elastics or whatever way you wish. To try to challenge your balance in a nice safe place at home. And postural re-education would be part of that physical fitness change. In my Venn diagram, you can see changes to habits, and you're probably wondering what habits I'm thinking about. But just the way you get in and out of chairs, how you go from sitting to standing can make a big difference. on the posture and wear and tear on your spine. And little habits, maybe being a little bit too sedentary, spending too much time sitting or driving. And I also have changes to your living space. And I'm not going to go into the living space thing today since we have an hour. But that would include things like having a barrier-free home. And a barrier-free home doesn't have stairs. It's careful about where the furniture is placed. Little things like having storage so that you don't have to climb up on ladders to put things away. That can make a huge difference. So I'm going to spend most of my time talking about the physical fitness and changes to habits such as biomechanics. And the question I often get from people is, well, when do I need to do this? And there's a common saying in Nova Scotia anyway, when's a good time to plant a tree? And
Yesterday.
the answer, does someone know the answer?
Yesterday?
20 years ago.
20 years.
So the second best time to plant a tree is today. So that's what I'm going to say. Make the changes now. And I'm going to talk a little bit more specifically about exercise. So activities that stimulate bone density are weight-bearing exercises. And there's been a lot of research done on this. And with premenopausal women, high impact activities with a lot of position changes. So any sport where you're chasing something is excellent for building bone. And for women, we usually are at our peak bone density between 20 and 25. And muscle strengthening is another thing that is always hand in hand with bone strength. And now I recognize that if you have some arthritic changes, high impact aerobics are not going to be really fun for you. So there always has to be a plan B. And there are lots of other activities too. And I'm just going to put this screen up briefly. The activities which don't stimulate bone density, swimming, even competitive cyclists have trouble with osteoporosis. Yoga, sitting exercises, they're all good for you. I'm not saying don't do them, but I'm saying continue to do those and enjoy them like as you always have, but make sure that you're putting in a little time for weight-bearing, bone-building exercise. And that should include balance exercises, flexibility, postural work, and strength or resistance work. So the minimal would be twice a week for 6 months before your bones would start to feel a difference. And I will. And I often encourage people that if you don't have any other big health challenges, you should seek the advice of a personal trainer or someone who's certified in fitness. And if you have other health challenges, maybe you already realize that you have osteoporosis, then it's a good idea to see a physiotherapist to be given some specific exercises. And I said I was going to talk about the behavioral changes or the biomechanical things we can do from day to day. The one I really wanted to focus on was just going from sitting to standing. And how many people have a yardstick at home? Yeah, so it's a pretty simple thing. It's not high tech.
That's true.
And
Meter stick.
Yes, or meter stick. Or a piece of doweling.
From Vanderbilt.
From Vanderbilt. And this is really simple to do, and it kind of reminds me a bit of the exercise where I had people stand up against the wall to see how their posture was. And all you do for this is you take the stick, put it behind your back, and if you're holding it in place, it should be touching your tailbone, in between your shoulder blades, and the back of your head. And what you're going to do is you're going to make sure that you're in front of your seat, well positioned, and you're going to hinge at the hips to sit down, keeping the spine properly aligned. So as I sit down, I'm not allowing the back of my head, my shoulder blades, or my tailbone to leave the doweling. And it's a good thing to practice, and it would fit along the lines of doing, if you were doing lunges and squats in a gymnasium, people would be crabbing at you to maintain the same neutral spine. And this is a really great thing to practice, and I often find that people, they have a lot of ways of getting from sitting to standing, and there are ways that can be detrimental to the spine. So a lot of people use their head to get up. They're not aware of it. I mean, we do these things on autopilot and don't think about it. But that is a wonderful thing that you can do for yourself to practice. And sitting to standing, I mean, that encompasses getting in and out of a car, getting out of bed in the morning, going to the washroom. It's really, really important to be able to do sitting to standing correctly. Get much better longevity from your body parts if they're aligned correctly. And so I would encourage everybody to go home and get your yardstick or a doweling and practice that, because that is excellent body mechanics.
How do you get out of smaller cars when you're down like this?
Oh yeah, I know. If you're in a smaller car and you're parked next to a curb, you're probably going to have to break some rules to get your head out from underneath them. Yes, but I wouldn't encourage you to go take your smaller car and practice there. I
No,
would try
okay.
to practice it the right way. And there's always times when you get in tight situations that you have to modify slightly.
You should try and swing out if you can.
Well, and since we're talking about cars, the right way to get in and out of the car is the way that Queen Elizabeth does it. So the door is open, she turns around, both feet are on the ground, and she puts her bottom on the seat, and then she swings her legs into the car one by one. So that really is the proper way. And if you think about Canada, ice and snow, you don't really want to get out of your car with one foot in and one foot out, because sometimes you end up like a turkey wishbone. And you do not want to do turkey wishbone. So that's one really good habit that you could correct. And I'm trying to train myself to do it properly now. So then will be my new autopilot will be that I'll be getting in and out of cars correctly.
Like a model.
Yes. There's probably a reason why they do it that way, isn't there? There's lots of ancient wisdom out there that's entirely correct. So I had mentioned with my Play-Doh that when the vertebrae are all healthy, they line up nicely. But you can see they're very unstable. And the part I didn't mention to you at that point was that we have a lot of muscles that support our trunk and our spine. And I like to think of them as guy wires. The same way when you see a communication tower in the middle of a field, and it's got a million little guy wires coming out in all planes to try to keep it secured. So if your guy wires are evenly balanced of the same tension, then your tower stands nice and straight. If your guy wires are tighter on one side than the other, then you tend to have a crooked spine. So it's really important to have a strong trunk when you are trying to preserve your spine. And certainly find there's lots and lots of exercises for arms and lots of exercises for legs, and it's a little more challenging with the trunk. That's really where a person needs to go. And the muscles that go around the middle of your body, or your abdominal muscles, are all placed on diagonals. And I don't know if you guys remember the 18-hour girdle? That there used to be
We do.
commercials for it. Yes, thank you. Well,
Not that I wore it.
Remember the advertisements, right?
the advertisements,
Yes,
and then they talk about the elastic and then running on diagonals. Well, they're just copying what's already in your body. And like a Chinese finger trap, if your diagonal muscles are strong and of a good length, then you will have a nice tight abdomen, which will support your spine. And I wouldn't want people to go out and start doing curl-ups if they were thinking about strengthening their abdominal muscles. I tend to think of the planks, the side planks and the front planks, and things that are strengthening your core without curling it up into a letter C. And this is an example of a way that you can strengthen your back muscles. As you can see, the person's lying on their tummy. Their head is in a neutral position. It's not like the cobra that you see done in yoga. And you're just lifting your arms and your spine and your face away from the either bed or the floor. And that's strengthening the muscles, the erector spinae muscles that run up either side of your spinal column, helping to keep them strong. So when you're standing up, it will be the same muscle groups that would keep you tall. So I talked about a bit about physical activity to avoid and to treat osteoporosis, and biomechanics to support good joint use and avoiding falls. And I would be remiss if I didn't say something about nutrition and pharmaceuticals. And since out of my scope of practice, so I'll just give you the general information that you could find at the Osteoporosis website, osteoporosiscanada.ca. And so nutrition, it's wonderful to have adequate amount of calcium so your body has something to work with. And vitamin D is really important as well, especially for us in our climate where our skin is not exposed to sunlight all year round because we'd freeze. So vitamin D supplements, and they're currently recommending a minimal daily dose of 800 international units and a higher dose of 1,200 would be normal. And that's a cheap thing to buy in the drugstore. A pharmaceutical point of view, there are lots of great medications now that can help reduce the loss of bone and actually build bone back again. And that's been a huge change even in the last decade. There used to be very little you could do to treat somebody who had osteoporosis, but there certainly are great pharmaceutical options. There's options that you swallow in a pill form. There's ones that you snuff up your nose, like little nasal sprays. And there are even injectable medications that can be injected twice a year and improve your bone health. So that's something that's important to ask your primary healthcare provider if you've been identified as having some weak bones, that this is something that could make a difference in your bone strength within a year of starting a pharmaceutical. And again, I always try to help people with their posture and their strength, but these additional things are extremely helpful. How am I doing for time, everybody?
It's 42.
Okay, I'm all right.
Your hands are busy.
That's right. Lisa's probably getting tired of holding it up. Now, the reason why I'm telling you about pharmaceuticals is I think that this is really underutilized in Canada. And this is just an example of the bar graph is comparing somebody who's had a heart attack, identified at the hospital, and they've been treated for their heart attack, and 80% of them are going to leave with beta blockers or some other medication to treat their heart problem. If you present at the hospital with a broken hip, there's quite a chance that you're going to leave and you're not going to be being treated by any pharmaceutical. So right now, only about 15% of people who have broken a hip are leaving the hospital with medication to prevent the second hip from being broken. And this, from my point of view, is a tragedy because we know that if you've broken one hip, the chances of breaking the next one are very high. So within the next 5 years, there could be a second break. It's really important to have that intervention. And that's something that I carp about all the time. I don't have the ability to prescribe I just have the ability to pick out people and say, you know, I really think you benefit from this, and to make sure you ask that question of your primary health provider. Another way of diagnosing osteoporosis is with a really simple test called bone mineral density. And this is not to be confused with a bone scan. This is not a bone scan. It's inexpensive to do this test. Lots of times you don't even have to take your pants off to have it done. They're just looking at your hip and your low back. That makes a big deal to people. You'd be surprised how many people will turn down having a test.
Men or women?
I think it's both. So I throw that in there because it does make a difference. And this simple little test can tell you where your bone density is. And this is great. Before any of those changes that I mentioned, the losing the height, the changing of the posture, this can identify that problem before you actually have clinical signs of osteoporosis. So cheap test, usually it's recommended that for women that we have this test when we're perimenopausal, so we know where we're starting. But if you for some reason had a fragility fracture when you were, say, only 40, that would be another indication that perhaps you need testing early. And this is all about women's health in Canada. And this bar graph has compared the incidence of breast cancer, stroke, heart attack, and fragility fractures for Canadian women. And the purple bar is just hip fractures alone. And if you add in the spinal fractures, the wrist, the pelvic fractures, and other fractures like ribs, then you can see that it's a staggering incidence of osteoporotic fracture in Canadian women. So, and it causes a lot of disability and misery, and it's easy to figure out how much money it costs, but it's not always easy to see what kind of devastation it can cause in people's lives. And the bad news is that broken hips particularly can be life-threatening. So within 1 year of a broken hip, 28% of women will die and 37% of men. So as I was saying, it's a little less common in men, but it's more devastating. And for people who have hip fractures, only about a quarter of them leave the hospital and go home and carry on with their lifestyle the way it always was. And the other 50% maybe go home, but perhaps need to use assistive devices to walk safely, or perhaps need to have some sort of in-home service delivered to help them stay living independently in community. So it does make a difference, and it's well worth trying to prevent and to treat. So that's a lot of information that I've dumped on you guys. My parting slide is going to give you a little more direction. And Osteoporosis Canada is a very incredibly good organization. They provide training for both healthcare professionals and for, say, fitness professionals. And they have lots of really good networks for people. They have a weekly newsletter that's called COPN, C-O-P-N. And there's lots of resources if you should ever want to find out about something specific relating to osteoporosis. So I always encourage people to look for these courses, and I guess for the younger group that we're here that are working and looking for a career, it's a wonderful training to have. And for people who maybe are wanting to be treated for osteoporosis, on the website it also lists other healthcare professionals and fitness professionals that have the training and where they're practicing. So that can be a very useful resource. particular bone fit course was developed in conjunction with Dr. Judy LaPrada. She's actually a Queen's grad too, which is just a little fascinoma that I'll put in there. So, I'd really like to encourage Canadians of all ages to remain active. And I would like to see a full spectrum of fitness venues available for people. And I would like to hear that there's more people demanding that they have bone density testing and asking, you know, what more can be done. Because I think that it's available and we're not using it to the extent of its capability. And I'm going to be loitering around here for a few minutes if people have any questions or if they would like to try the doweling to go from sitting to standing, or just have any questions in general, because I know I talked for a long time.